Hi, my name is Lauren Brown. I'm the chair of the Integrative Fertility Symposium. I'm also the clinical director of AcuBalance Wellness Center in Vancouver, British Columbia, Canada. And today I'm interviewing Dr. Laurena White. She's a medical doctor. Well, actually, I'm going to ask you, what is your background? You are an MD.
Yes.
OBGYN.
Yes.
REI.
Yes.
So your IVF doc for those, that's an REI. You are a licensed acupuncturist.
Yes.
Clinical herbalist and an
Yes.
author.
Yes.
What's the title of your book?
The title of the book is Natural Pregnancy. Hold on one second. I think I may have it on my shelf.
Let her grab that on the shelf. And the reason we're chatting is Dr. Laurena White just did, keep holding that up, please, Dr.
Okay.
White. She just did a professional talk for acupuncturists, naturopaths, and health professionals on using an integrative approach, a lot with Chinese medicine, acupuncture, herbal diet, lifestyle for treating fibroids. And so now we're just doing a little public talk. Can you bring up the book again one more time? I want to read the title for them, for those that aren't looking at the screen clearly. So her book is called Natural Pregnancy Guide, Empowering Moms to Make Healthy Choices. Excellent. Thank you. I'm sure you can find that. Google Dr. Laurena White's name and her book, and you'll probably find and get a copy of that.
And it's on Amazon as well. So you can just,
there you go.
Have the link to Amazon too.
So you're trained. The reason I wanted to talk to you, because, you know, people will see their naturopathic physician, the Chinese medicine doctor, and they'll say, we can help you with fertility. We can help you with fibroids in this case. And then their physician will say, I don't know, there's not evidence, you shouldn't do this. And I think it's really nice because I refer to you sometimes as Doctor 3.0 because you are actually trained in both and you're using both in your clinical practice. So let's just cut to the chase and I'll ask this question. Clinically, are you using an integrative approach? Because you have the option to do surgery and diet acupuncture herbs. Are you using diet acupuncture herbs integration when you treat fibroids in your practice?
Yes, the answer is yes. I got into this approach because I felt that there were limits to both the surgical or the conventional approach, as well as limits to the solely only acupuncture or TCM approach. And so marrying the two, the synergistic benefits are overwhelming. They are clear. I don't have any problems defending both. And they're necessary, especially in this age where many people are using assisted reproductive technology or using IVF or any other aspect of assistance to help them with the conception and pregnancy, as well as acupuncture and herbal medicine as well. And they both have very, very important roles and responsibilities in the conception and pregnancy journey.
Now, you said herbal medicine. This is an important one too for the public because a lot of time reproductive endocrinologists and OBGYNs say, okay, the acupuncture is fine, but we don't want you to do herbs. My understanding is they think of them as like drugs and because they don't understand, maybe there's some uncertainty around it. Yeah. But you're trained as a clinical herbalist and an OBGYN, REI, IVF doc. So you are using herbal medicine when women are going through an IVF?
Yes.
And
if their presentation is necessary as such, we're using herbal medicine during the IVF process. I find that once we get to the IVF process, there's less need to use herbal medicine because during that process, before trying to conceive, we've been using Chinese herbal medicine during the preparation process. But during that process, if there's need and if it warrants, we definitely incorporate Chinese herbal medicine in the IVF process. And there is a lot of uncertainty. There is a lot of questions. How is this going to affect my protocol? How is this going to affect my results and the end game? Because the patient is both of our main concern is how is this going to benefit the patient? I would never do anything that are going to affect results. I would never put an herb or anything that's going to negatively affect the result because at the end of the day, who's being affected? It's not just our results as practitioners. There's a patient on the end of these decisions that is going to be negatively affected. And that's who my main concern is. And because I dance well in both worlds, I'm able to see what is going on in the body from a clinical perspective, as well as from what is the synergy between the actual herbal medicine and the pharmaceutical medications as well, and what the process is like as the body is experiencing IVF or any other assisted reproductive technology, and how the herbal medicine and acupuncture can synergistically benefit the patient and improve outcomes.
And so you are seeing that clinically, then you'll have had women that have gone through an IVF, and then you'll introduce the integration, the acupuncture herbs. You mentioned that preconception. So not just when the IVF starts, but like that 100 days, 3.5 months before the IVF. So clinically, are you seeing better pregnancy outcomes when you're doing the integration versus not?
We have about an equal third of patients who have no intention of ever doing anything with IVF or any type of ART. One, because either they don't have enough money, or they don't have enough insurance coverage, or they've run out. And so they're still trying, but they have no intention of incorporating any of those technologies into their process. Another third is that third that's like, okay, I want to do everything that's going to help me achieve my end game, which is to have not just to get pregnant, but to stay pregnant and have a healthy pregnancy and a healthy mother-baby dyad. And then there's the last third that's like, you know what, I'm not doing anything about herbal therapy or acu. Sometimes maybe I'll consider acu at my retrieval and my transfer, but I'm not doing anything else with that. So we see about an equal third. And when I look at those who are just doing on the polls, I find on either end that they're not those who are just like, I'm not doing anything with artificial and I'm not doing anything with natural. It's either all or nothing. They definitely function differently. I won't even say worse, because some things are happening faster, but some things are happening better in terms of health, wellness, and well-being. But those in the middle who are taking advantage of the IVF or the assisted reproductive technology, and those who are using acupuncture, herbs, diet, nutrition, massage, all the other integrative aspects that we offer at our practice, they're the ones who are doing better. That group in the middle who are definitely taking a part of all of the things and the options that we have to offer, they're definitely doing better.
That integration. And it's fortunate for the patients in your city, your state, because you get to do both. And for those here in Vancouver, we're fortunate that we work with a clinic that is open to the integration. So we're doing the acupuncture herbs, the diet, the mind massage, abdominal massage in our practice, and then they're doing the RT, but we communicate and we're doing the herbal in that preconception. So it's great where we are in 2021 that integration is becoming more of an option and people are open to it.
Yes. And I think it's important that as not only as providers that we are open to and having that experience being accessible for patients, but that patients, once they know that it's accessible and it's an appropriate means to getting to their end game, that they take advantage of it. And now we're starting to change the system from the inside out.
How important is it to do that preconception? Because some people say, okay, I'm starting my IVF, so now I'll start the acupuncture. How important is it to do the preconception? And if you had a time, how much time should people allow for that preconception?
There is really no flat answer. Some patients will start off and they know they want to get pregnant. They have a time frame, like they want to get pregnant yesterday. And we're looking at, okay, but you're not getting pregnant. Do you want to get pregnant or do you want to stay pregnant and have a healthy mother-baby dyad? What is actually the end game? Because getting pregnant, honestly, is only about 25% of the whole equation. Getting pregnant, staying pregnant, meaning not having a miscarriage or not having a preterm labor, and then having a healthy mother-baby dyad is the whole 100% the end game. So when I look at a patient and I evaluate them, I take in consideration what other conditions, what other processes are we working with? Is this an age factor? Is it an egg factor? Is it an egg quality factor? Is it an egg quantity factor? Is it blood circulation? Is it uterine blood circulation? Is it diet? Is it movement? All these things I take into consideration. What other body systems are affected? And so when I look at them as a whole person and I look at their lifestyle, I take into consideration, is this something that we can address in 3 menstrual cycles, or is this something that I need to address in 6 menstrual cycles? And I take into consideration, once we make these changes, are you going to be able to stick with them? These are lifestyle changes. These are not changes that we're making just so that you can get pregnant. And I think a lot of times patients look at that as a means to get pregnant, but they're not looking at it as a lifestyle change that they can sustain even after pregnancy. So preparing them subsequently for the subsequent pregnancy. And once we can motivate change that, okay, this is a change that you're making for your life. This is a change that you're making for overall health and wellness and your overall health and well-being, that it's easier to make those changes sustainable. So if I had to give an average, between 3 and 4 months is when we start that preconception care. And that includes acupuncture, herbs, massage, body work, nutrition counseling, all the overall aspects that are going to address any potential complications that we can foresee, or any potential hindrances that we're already seeing that are affecting one's ability to conceive, stay pregnant, and continue to have a healthy life.
I was quite pleased when you did your professional talk that you talked about the acupuncture, herbal, and diet and body work and stress reduction. Yeah. And you also talked even about Feng Shui. I think you're the first reproductive endocrinologist that I think would ask their patients, what about Feng Shui in their home and work. So that gave me a big smile when you, we have everything in our clinic that you talked about, but we don't have the Feng Shui expert.
Yeah. So we don't necessarily have a Feng Shui expert. That is like probably the person I'm looking at to really bring onto our team that would like really blow everything completely to the next level. I'm actually a Feng Shui nerd, so I know just enough to make me dangerous, but not enough to really do like the real heavy lifting. It's just one thing that I've done with my own home. I've done with my own office. So I know there's certain aspects that I'm confident enough that will definitely help change the work environment and the home environment. But again, I'll let you know when I find that Feng Shui expert to add to our team.
Excellent. So if you're looking to have healthy baby and healthy mom, that healthy diet that you talked about, then how do they find you? What's your website? So if they want to connect with you?
Okay. The website is LaurenaWhite.com. My full name, LAURENA White.com.
And then let's see your book one more time so they can get a copy of your book if they're interested. So there's her book that came out recently, Natural Pregnancy Guide, Empowering Moms to Make Healthy Choices. I also will give a plug for a free book that we have at AcuBalance. It's the AcuBalance Fertility Diet with recipes. You can get that at acubalance.ca. And what city are you in?
I live in Northern Virginia. Our offices are in Columbia and Old Town Alexandria.
So if you're in that area, then Dr. Laurena White is the person to see. And if you're in the Vancouver, BC area and you want this integrative approach, then come see us in Vancouver at AcuBalance Wellness Center. Dr. Laurena White, thank you very much for putting these lectures together for the Integrated Fertility Symposium, those professional talks. And thank you for this public interview as well.
Thank you so much.